Hello, nursing students. Today I'll be walking you through a lot of the ATI processes that we have. By the end of this video, you guys will be able to demonstrate the correct medication scanning process in ATI, perform the third check using barcode verification, accurately document medication in the chart, safely administer PO liquid and injectable medications, identify and respond appropriately to incorrect medication alerts, and access and interpret lab results, trends, and diagnostic imaging during the simulation. So let's get started. So you just removed your medications from the Pyxis and are now walking over to the patient with your little med cup in hand, ready to give all your medications, about to explain what each medication is, what it does, and any important teaching points to the patient, and then you will move on to your third check, the scanning process. Okay, in the scanning process, it starts off with the patient's medical record number, which is located on the QR code of the patient's wristband right here, and that's what you will scan to access the MAR. Once the QR code on the patient's wristband has been scanned, it'll take you directly to the the MAR, where you guys will see all of the patient's medications, and from here you can start by scanning each medication one by one and updating the patient's chart afterwards. So let me show you what I mean by that. So my patient here, Dwight Schrute, has an acetaminophen or an oral tablet at 325 milligrams. And I assessed that my patient has a fever of 101. So first, what you will do is scan your medication right here. And a little menu should pop up with more of the medication information of the medication you just scanned, and the dose, the actions that you're doing, such as giving it, starting it, holding it, the patient maybe refused it, and the time right here. The time is always going to be morning shift. You're always a morning shift relieving night shift, so the time will always be around 7:45 to 8:30 from your sim. If I wanted to say give another tab, I know that the MAR does not say give a 650, but say I wanted to give 650, I would pull out another one of my little tabs right here and scan that medication, and the dose should automatically update. Right there. The dose went from 325 to 650, and then from here I can hit update chart. But what you can do as well is scan another medication. For example, my patient is still in pain. I've assessed that his pain is 7 out of 10 on a pain scale, and it requires a morphine, which is conveniently in his chart. So I will go ahead and scan my morphine. There we go. Once I've scanned my morphine, it now shows that I have two medications within my chart. And let's look at the morphine. Here you guys will see all the exact same instructions as the acetaminophen. You guys will see the dose, the frequency, the route, start and end time, dispensed, which is an injectable for the morphine, approving provider, which is Dr. Poor. The only difference between the tablet medications and the liquid medications is you guys will actually be drawing up the medications and inputting how many milligrams you are giving. For example, this morphine right here is 2 milligrams over 1 ml. So I would pull out 1 ml. But for the dose, I would say I'm giving 2 milligrams, but I pulled out 1 milligram, or yeah, 1 milliliter. Sorry, I should say 1 cc. Pulled out 1 cc. And then once I have scanned all of my medications and I'm ready to update the chart, I'm going to hit update chart right here at the very bottom. Oh, there we go. Sometimes it just wants to make sure that you have all your information placed on there. For example, this one right here is missing a value. It needs to have some form of dosage here or some form of unit of measurement. So for this one, I'm going to put my milligrams. There we go. And actually, because I wanted to only give 325, I'm going to update it just to 325. Right there. Update chart. There we go. It should say your medications have been given. And if we scroll down here, I can see that my acetaminophen was given and my morphine was given. And that's how you guys scan medications into the ATI scanning system. Now, after a while, ATI does have some form of expiration time, so you may have to rescan your patient's wristband if it prompts you. So it may give you a little prompt saying, "Oh, please rescan your patient's medical record number." In which case, you would just go ahead and scan the patient's wristband again, and it'll take you directly back into the MAR. If too much time passes, you have to rescan. This is normal. This is normal during the learning, so just rescan and then continue. Now, with PO medications, we ask that you guys do not open them when you are giving them to your patient. Just verbalize, "Oh, are you able to take all your medications at once?" The patient will always say yes. They can take all medications unless stated otherwise. Um, we don't want you to open the pills unless you need to cut them in half. If you need to cut them in half, we want you guys to open it and go through the process of cutting that tablet in half, so that way you give the appropriate amount of medication. So if, for example, my acetaminophen was a 650 tablet, but I needed to give 325, that's a situation where it's okay to open up the package and cut it in half. But if the acetaminophen is already at 325 and the order is 325, please don't cut the PO in half, please. And with injectable medications, when you have drawn out your medication, we want you to verify that with your instructor. So not only are you scanning the medication, inputting your dose, and trying to and putting in how much you pulled out, what you will also be doing is verifying that same dose with your instructor. So I want to show my instructor that I pulled out 1 ml. Because if I pulled out 2 mLs, that means I'm giving my patient 4 milligrams, which is 2 times the order stated. So that's something we want to make sure that we're keeping track of, and we understand that we have to make sure to show our instructor the amount we pulled out for liquid medications. Okay, now that you guys are masters with the medication side, now it's time for reviewing calling labs and obtaining our diagnostic data for our simulation. So, during the simulation, you are responsible for monitoring labs and diagnostic results. For the labs, you will call for any labs that need to be repeated or redone. Admission labs should already be on there for you guys. So, for example, if I look into my labs, I should see some starting labs right here. Dwight Schrute has a white cell blood count of 16.4. That's a little concerning. That could be an infection right there. And everything else seems normal. But say I've assessed my patient and I've called the doctor and I've let him know about the white blood cell count. The doctor has now stated that I need to repeat the labs and call labs again. So let's go through a quick round of what that would look like. So I will call labs right here. Bring, bring, bring. Who you calling? This is Christian Miranda. I'm calling lab. Okay, this is lab. Hi, I'm trying to get some repeat labs for my patient. My medical record number is 254-18381. Let's see here. Dwight Schrute? Oh yeah, that's him. Okay, perfect. We'll shoot those results up for you right now. Perfect, thank you. Okay, and once you've called, you need to refresh your screen. There is no refresh button on this web page, as you can see. So the way you would refresh the page is just tab something else, like for example, patient information, and then go back into your labs. There we go. And then here you guys can see that there are some trends right here. You guys are able to see, you guys are able to compare the initial labs with the repeat labs. And for example, now I can see that his sodium and potassium are low. So this now tells me this is an electrolyte imbalance, which I will then call the doctor about, and they will give updated information. They may give me a verbal order on PO medications. Maybe I need to give some potassium. But that is how you guys will obtain labs throughout your scenarios. All right, now that you guys know about the labs, the diagnostic tests and imaging results are very similar. What you will do is say there is an order for an ultrasound on my orders. What I would do is I would pick up my phone and I would now think about calling radiology. Bring, bring, bring. Hello, who you calling? Hi, I'm calling radiology. I needed to get my ultrasound ordered for my patient medical record number 254-18381. Is that Dwight Schrute? Yep, that's him. Okay, perfect. So I will send you up the immediate results right now onto your computer. Perfect. Thank you very much. And again, you would need to tab in, tab out of another screen. So again, let's just go to patient information, and then now let's go into my imaging and diagnostic tests. And there you go. You guys can see that he has a chest x-ray right here and it's all normal. I think I said an ultrasound, but let's just pretend I said chest x-ray. So I just received my chest x-ray and it's right here. You guys can view an image of the screen right here. To exit this view, just click again and you guys should exit out of there. And it should have some form of description right here. It may be longer throughout the sim. This is just a little example, but you guys will have a little explanation of what the diagnostic test resulted in and what the result is right here. Whether it's a chest X-ray and it's normal, here it is, and that is how you guys receive imaging and diagnostic tests throughout your simulation. Okay, guys, some final reminders. Just remember that you may need to rescan your patient ID if prompted. Remember to hit update charts, and that way your results are documented. Otherwise, kind of like hospital rules, if they weren't charted, they didn't happen. Verify any liquid doses with your instructor. Oh, look at this. This is perfect. This is the little message I was talking about right here. Wristband verification expired. Please scan the patients again before administering medication. And here we go. I can rescan it. And my patient's wristband has been successfully scanned and takes me to the MAR. That's a great little example. I'm glad that showed up. Remember to review any labs initially. You may have labs already. If not, you would have to call for them. You guys can review any trends and compare them side by side. You guys are able to call for any imaging and diagnostic tests, and they will be automatically resulted here on your computer. Remember to complete all your other checks. This covered mostly the third check and what to do there. But remember to continue on with all of your other checks, 7 or 17, however there are by the time you guys graduate. Thank you very much, guys. I hope this has helped.